Welcome back to our Blue Z Water channel. Today I just want to go over how to use the electrostatic charge therapy, high frequency vortex electrostatic charge therapy to be exact. We have a whole playlist of many videos on what this therapy does. Today we're just going to give a brief instructional video on how to use this. So first of all, this is the box it comes in. This is the control unit. This is the large coil, this is the medium coil, this is what's called the toroid or donut coil, this is the power adapter. And also we have a little test light. Okay, so we're going to set it up and show you how it works. Okay, so basically you plug in the power adapter to an outlet. It's a variable power adapter, so it'll work on a 110 or 220, so work in either Europe or America. Okay, so we have here the control box plugged into an outlet. This is where the adapter goes. And then what we're going to do is we're going to plug in this large coil first. We always start off the therapy with the largest coil, which is the weakest coil. The smaller the coil, the more powerful. Many systems out of Russia just have basically a variety of coils, and you keep changing out the coils to get extra strength. What makes this system unique is it has 10 power settings. So within each coil you're using, you can adjust the power incrementally from 100 milliamps to 1,000 milliamps. Okay, so what we're going to do is we're going to turn it on. Now we always start every treatment with about 20 minutes on the kidney area and then about another 15 minutes on the liver. So this defaulted to, we're going to turn the power all the way down. Here's the time switch. So it says 1 hour 47 minutes. If you press it, it'll blink. Now you can change the time, press it again. If you want to set it to infinite time, just hold it for 3 seconds. You get those 3 dots. That means it's just going to keep going until you turn it off. If you press it again, it goes back to the default time you had before. Okay, so once again, you press it, it blinks. You set the time, press it again. Okay, so this is the coil you're going to be using. Here's the power switch. So we're going to turn it up real low. This is, pretend this is your first time. And for those of you buying it, it is your first time. So you're going to test the waters. The first stage of using this system, much like medical ozone therapy, is what we call the acclimation phase, or I call it testing the waters. So you're going to go, if you're very, very, very sensitive, start real low. This is the weakest coil, and you can go, that's 100 milliamps. It's the lowest setting. If you're not that sensitive, you could maybe go here, start there. Okay, but let's just assume everybody's quite sensitive. The first time you do it, you want to test the waters. You're going to take this coil, they call it coil, and you're going to put it on your lower lumbar, like mid-lower lumbar area between the 2 kidneys. And you're just going to sit there. Doesn't matter which side, by the way. People ask which side, this side or this side, doesn't matter. And you're going to do it for 20 minutes. You can do it for 30 minutes. And you're going to drink a glass of water before you start, a glass of water after. Okay, so you're going to do that in the morning, preferably. And then you're going to move it to your liver area. Generally, the front of the liver at the lower right rib is a good place to go. And you're going to do about 15 to 30 minutes, minimal 15. I'd say minimal on the kidneys is 20, minimal on the liver is 15. Okay, that's your first treatment. So now the next morning or the next day when you wake up, or later that same day, notice if you have any odd reactions. I've had people actually pee black urine from doing gentle treatment. So it can range from no reaction to some type of Herxheimer reaction, meaning excessive peeing, discomfort, detox, general detox reactions. The kidneys for most people are not at a real high functional level. So this is going to work on the whole, cell by cell, the entire kidney, and help to repair the kidney of the liver. So you can now do better detoxification. Now, let's say you have some lung issues or thyroid issues or any other system, pancreas, spleen, stomach. After you do the kidneys and the liver, you can now treat any area you choose. Maybe your knee hurts you or your elbow. This isn't a miracle system for every and all issues. For body work issues, we have different protocols, but this is a systemic therapy that helps with detoxification, getting rid of microbes. It works best with medical ozone. Medical ozone and this therapy have much in common because they're both running essentially what I call lightning therapies. Electrostatic charge is like lightning, and ozone is made by putting a lightning strikes in a machine called corona's discharge, hot oxygen, and infusing that into the body. The difference with this is when you infuse ozone into the body, it just whooshes past the kidneys and you really don't get sustained organ treatment. With this therapy, you can focus on your organ systems, all of them, lymphatics. You can go anywhere in the body and basically put the field at that area. Now the question is, how intense can you go? Well, you can't just go from 0 to 100 around a curve and expect not to crash. So you have to kind of get used to treating the body, break it in, acclimate, and increment slowly. Okay, so the more chronic you are, you just have to be patient, and the more therapies you're going to want to do in conjunction. But anyhow, we're going to start with the kidneys, go to the liver, and then go around the body to any area that needs attention at a power level you can handle. This is the most gentle coil. So as you work up day by day, if you don't get many reactions, you can go up the next day here, the next day here. I mean, if you're just not getting any reactions, you can go up every day until you hit 100 milliamps. Maybe you get a reaction right here on day 4. You stay there for a few days or go even back down a little. So if you hit a bump in the road, back off, or just stay the course, and then gradually you'll go back up. Okay, so once you get used to this coil, it might take you 5 days, it might take you 5 months. You're all the way there. You're ready to go on to the next coil. So anytime you put the coils in and out, turn off the machine. Okay, so the next coil, this is very easy. The next coil is this medium-sized coil. Plug it in, turn it on. It's going to default to the time you had previously. Adjust the power, start low now. This is much more powerful to begin with. So you're going to start low and again work up day by day and find an acclimation point. When you get at full strength here, this is a very, very powerful field. So you don't want to stay at full power in an area for too long. Maybe 1 or 2, 3 minutes, move on, go in a cycle. Let's say you're treating a headache, you might go one part of the head for 3 minutes, then go to another part of the head, and to do another round. If you're going to do steady state on the liver, once you acclimate, I'm usually around here or here. 20 minutes on the kidneys, 20 minutes on the liver, or give or take. I mean, you could be doing something and forget about it, no problem. You can spend way more time on the kidneys, way more time on the liver. Then once again, you're going to go to the problem areas. Let's say you have lung issues, thyroid issues, or some kind of tumor or blockage. Anywhere in the body, you're going to go start treating those areas. Now, this permeates into every cell. It's really very subtle and powerful at the same time. But if you have a really dense blockage, let's say structural, let's say you have really bound up fascia in your leg, you're not going to use this therapy as a heavy-duty breakdown therapy. Then we recommend our high-frequency PMF device, which is really meant to break up dense fascia, dense blockages. This is more microcellular, helps change the toxic structure of the DNA of a cell. The inventor of this whole technology said it changes it unbinds closed loop DNA formations. So it's working at the cell level, the DNA level. This is what I call the alchemy of lightning, permeating into a cell and breaking up deep blockages at the microcellular level. Another therapy that's microcellular that we recommend, that's a real balance for this therapy, is our BG60 Brown's gas machine, which is hydrogen, oxygen, and fourth stage plasma, which is a form of water. So each therapy has its purpose, but we always ask you to think what therapy actually can get through very toxic terrain. Let's say your liver's all messed up. Will this go deep into the liver? Yes. It'll go at the cell level, and it has, once you get up to a stronger power, and it might take some time to break in, but then you can dive deeper into that toxic liver and turn up the power. You're going to find that sweet spot where it's getting in, but it's not, it's like cooking if you turn the flame up too high and burn the pan. So you got to get to that sweet spot where you're not going too hot, too fast. Anyhow, once you get acclimated, this is going to be your main treating coil for regional treatments, for the kidney region, for the liver region. It goes about 3 feet in diameter. The epicenter, of course, is here, and as it spreads out, it loses some power. And basically, this is your regional treatment. You could treat the lung region, the kidney region, the liver, pancreas. Think of a 3-foot radius, basically. Alrighty, so you work up, acclimate, just as in the big coil. Once you break in with this therapy, this is just what you're treating with all the time for regional focus. Now, when you really, really need to dial in, we're going to go on to the next coil. So turn it off, unplug it. And this is the donut coil. Now, this is like what I call sort of in all my therapies, there's sort of the more, what I call the shotgun effect, and this is more like the sniper bullet effect. This is the most powerful coil. And by the way, we're going to show you how the tester works, which we forgot to show you. Every time, okay, you can turn on this one, I'm turning it all the way up. That light will show you that it's working. It gets brighter as you get closer. This coil is the most powerful coil, and it goes maybe 5 or 6 inches into the body, very focused, not a large radius. So if you're treating a very specific area, let's say a really bad lung infection, you can put it directly at that area. But keep in mind, you do not want to stay a long period of time. You want to crank this up, use it for very, very powerful short blast therapies in very resistant areas, a very heavy-duty infection, like a lung infection or even a tumor. But you can't just go at one area. You have to go at the whole body, detoxify the whole body. That's very, very vital. So you're going to turn this one mostly all the way up, although you can control the power. But again, you're staying in a very focused region, maybe 5-6 inches in, small radius. So this is your, very focused treatment coil, the most powerful coil. Do not spend long periods of time trying to blast away one area. You want to go back to the regional treatment, and then deeper than that, get those kidneys, the liver, the detox organs working, get the lymph working. Just get the entire microcirculation working in the entire body. Okay, so one other feature. On any one of these coils, you have what's called a sine wave and a square wave. The square wave is more aggressive. This is sort of like Rife therapy. Sine wave is smoother, so you can pick whatever waveform you like. Once again, this is our power setting from 100 milliamps to, now this one will only go up to about 350 milliamps. It will, if you went higher, it would burn out the coil. So this is so powerful, you can't go any hotter than 350 milliamps. Alrighty, so once again, you're going to go through a acclimation phase with the large coil. Then once you acclimate, go to the medium coil. You'll find break in with that and eventually settle in on around 350, 400 milliamps for your daily treatment. And then use the donut coil for very, very stubborn, resistant areas, very focused. If you have any questions, you can contact me, Andrew, at bluezeawater.com. And we generally, when we sell this device, we will use either some text messaging or short phone calls, especially the beginning week or so, to assess where you're at. We will try to help you assess that you're not going too fast, too aggressive. We'll check in and kind of give you advice as where to go. You know, the first, let's say 5 or 10 treatments, you know, stay there, go up a notch, especially for those of you who haven't really worked a lot with Herxheim or detox reactions. Always drink plenty of water and look at our other therapies that integrate with this therapy. This is not just a one-shot wonder therapy. This really integrates well with medical ozone, and then we advocate very, very high-end probiotics to really keep your gut immunity in good tow. All right, thank you, and we're going to move on now to the ESC Rife therapy.